Welcome to Omnia Health Insights, your one-stop resource on all the latest developments transforming the healthcare industry. Today we have with us Dr. Manish Kohli from Albright Stonebridge. Welcome, Dr. Kohli.
Thank you.
Do you think that digital transformation equates to positive patient outcomes?
Well, first of all, we're not talking about digital transformation. We're talking about healthcare transformation catalyzed by digital tools and technologies. And the short answer is absolutely yes. And healthcare traditionally has languished and lagged behind other industries. And I think COVID has really opened eyes as well as the will to do things differently. It's out of necessity. When I look at success, and let's talk about what we define success as. And as I look at it from a physician perspective, from an executive perspective, but more importantly, as a patient, I want to get access to a high quality doctor, a high quality healthcare system when I need it, at the best possible price point that suits me and my needs. And the current healthcare system does not deliver that. And as a result, uniformly, the patient experience when you compare in healthcare to other industries is lacking. And not only the patient experience, I can tell you as a physician who's practiced in the paper-based world and the early technology world, our experience is far inferior in healthcare, historically, compared to using consumer devices. And I think a lot of thought has been going into design thinking and bringing solutions to the forefront until now. And what I see is that the pandemic has accelerated adoption of tools and technology that have existed for a long time at a pace that we only dreamed about. And I think that is an exciting point in time. And I truly believe it's going to be our generation, but your generation, the millennial that we were talking before the interview, who's really going to help us take the charge and take healthcare into the 22nd century.
So Dr. Manish, you just mentioned about some innovations which were already in place in the healthcare industry, which have been accelerated by the pandemic. Can you tell us a little bit about these innovations and also how are they going to evolve further and be used by the healthcare industry?
Well, very good question. So the most obvious is virtualization of work and care. The way telehealth has been adopted, the way we've all been working remotely, is unprecedented. I mean, I can remember prior to the pandemic having numerous discussions, and there were a lot of business plans drawn up on whether telehealth will pay for itself and whether the investment is worth it. Yes, there's a need here. And I think what pandemic did was it opened up the willingness of the regulators to enable practice of medicine across territory lines, but it also gave an opportunity for the payers, the insurance companies and other payers in the sector to say we're willing to fund this and support this. And I think the reimbursements of telehealth led to the vast adoption. But when we talk about digital transformation, it goes beyond virtual care and digital health. We really have to think about how healthcare ecosystems are going to be competitive in the future. And this is where you start looking at the fundamental building blocks of technology that go into healthcare. Gone are the days when we were thinking about data centers and servers and hosting applications. Now everything is moving to the cloud. And really integrating environments over the cloud so that large data sets can be processed and insights can be delivered for the right decision at the point of care. Again, looking at other tools like microservices, artificial intelligence, analytics to drive all the data that's collected in the cloud. So that's the back-end architecture. Then you're really talking about IoTs and the power that IoTs, Internet of Things, and the devices and sensors that connect to it enable. We're actually able to leap from the self to the quantified self. And imagine all of this data is coming into the healthcare enterprise. That creates an immense power to begin to create digital twins. And this just is not about patient care. It actually is about processes within the enterprise as well. So now imagine this, you've got a robust infrastructure with the robust AI analytics engine, and you've got amazing data coming in across the enterprise, but also from other enterprises centered around a patient. And now health systems have the ability to create digital twins of patients, procedures, processes, and simulate them to see what the impact is going to be on quality, access, and cost before they implement solution. So the risk in doing something is all of a sudden mitigated because now you're actually able to plan better using the tools and technologies that are available. I think along with this comes new challenges. Cybersecurity is on everybody's mind. As work environments have moved outside the four walls of every enterprise, and now we are not only in an era of bring your own device, but bring your own environments. So if I am doing virtual consults from home, or you are working from home as an executive in a healthcare enterprise, there are vulnerabilities potentially in your home environment. So health systems now need to think about how do we shore up the entire ecosystem to protect the data. And this is where technologies like blockchain and others come in. The final piece is really getting around some efficiency tools, which I get really excited about as a physician. There's a huge amount of burnout that physicians and nurses experience because the current technologies necessitate a significant amount of time to be interacting with technologies, entering data. Now we have technologies like ambient voice recognition and natural language processing. So you and I can be having a conversation and the system can transcribe a note that is actually going to be pretty structured and quite relevant without the need to do a lot of editing and a lot of entry. And I think those kinds of experiences are going to enhance what I care about the most as a patient, as a provider, is my relationship with my doctor. And funny enough, prior to the pandemic, the conventional wisdom was that the elderly will be slow to adopt name your technology. And when we look at the data from the pandemic, the elderly have been one of the fastest adopters of telehealth solutions. And not only that, when you look at patient experience and satisfaction with telehealth and virtual care solutions is actually better than in some instances in-person visits. And the main reason is I was able to book an appointment when it was convenient for me, access to care, and second, my doctor looked at me in the eyes, and I was not looking at his or her back. So I think the bottom line is that we are at the cusp of tremendous possibilities for innovation. And I forgot to mention one more thing. I think historically, we used to say that IT is going to create innovative technology solutions. Now we're getting low source code solutions which allow frontline workers to be engaged in the part of innovation. And when you look at any industry, the best solutions come from the front lines, not from the back end.
Absolutely.
So the ability for clinical care teams and non-clinical care teams to be innovators, but also for IT teams to learn about business processes. I think it creates a very nice ecosystem internally that fosters greater innovation, leveraging all the tools that we just spoke about. Yeah. So I think pandemic, for all the tragedy that it has caused, and it's been a rude awakening. But I think healthcare is positioned in a really compelling position to really make some fundamental changes and make patient care better for you, me, and everybody else.
It was quite interesting to hear about patients who are from the older generation being very receptive to telemedicine and digitalization in healthcare. Is there still a possibility that we are in a transition period and there will be a percentage of offline patients? And how will we evolve from this? Or are we going to swing back to being very much offline patients who go back to the hospital for checkups?
Yeah. So we're very much in a transition period. But it's also true that we cannot think in absolutes. As a whole, when you think about penetration of technology in modern society, globally, the adoption of mobile phones is increasing. In fact, you'll be surprised to know that more people have access to a mobile phone worldwide than they do to toothbrush and clean water. Imagine the power it creates in connecting resources to people who need it, right? Now, telehealth, for instance, virtual care will not solve every problem. But as we were talking earlier, if less than even 30% of the care can be offloaded from oversubscribed health systems, clinics and hospitals, and delivered in a remote location, all of a sudden you have a 30% capacity gain, which can be purposed for patients who really need it. High acuity, complex care, surgical care patients. So as we look at democratizing access to care, one of the ways is to really start looking at how are we delivering care and can we create efficiencies in the infrastructure that currently exists. And I think that's absolutely true. And I think this is where the pandemic has galvanized thinking. Now, when you think about new models of care, and I think that's really where what you're talking about, is that and will technology actually replace the doctor? I think those are the two underlying questions you're asking me. So when you look at the first piece, right, I think we are slowly moving away from health system-centered care to patient-centered care, where health systems, clinics, hospitals, ancillary facilities, and other needed services revolve around the patient, and then the patient consumes them where it is most appropriate. And this could be a function of patient's preferences, availability, and other host of factors. So the way I like to think about this, we are entering an era of a digitally connected, distributed models of care. And I'm giving a talk on this tomorrow. So please feel free to join everybody there.
I'll be covering a session as well.
Absolutely. So as health systems begin to adjust to the new reality, just beyond telehealth and virtual care, I think that's really what the discussions are going to be. How do we move from where we are now to actually a future state where we can be with the patient where it makes most sense? Deliver high quality care and deliver value, which means cost that is going to be not exorbitant, that is not going to lead to bankruptcy, but it's appropriate for the kind of care that's being given. The other issue is that the capacity we talked about that exists in the healthcare system. We'll see increasingly that we will have more and more complex care being delivered in the inpatient and even in the step-down or ambulatory settings. Because now we will have the ability to leverage data powered by technologies like AI and analytics to help us manage those complex patients in lower acuity setting. So this is going to really help us build an ecosystem that links hospital-based care to step-down care to primary care to home-based care. And I think that is the future in my opinion. Now, the fundamental question that everybody asks is, well, will technology replace the doctor? And my answer is absolutely not. In today's day and age, according to some studies, doctors spend as much as 50% of their time looking for information or entering information or administrative tasks related to patient care, but not direct patient care. Now that makes no sense from a patient care, patient experience, physician experience, and cost of care perspective. Doctors and nurses are highly skilled resources. In fact, there's an undersupply and there's a shortage of doctors and nurses globally. So our first step has to be, how do we begin to create paradigms and systems that allow doctors and nurses to be more efficient? If I'm spending more time doing patient care and less time doing administrative tasks, which now can be offloaded to machine learning and AI and lower skilled resources, all of a sudden you create a paradigm where doctors are now more available for patient care. And just like the experience with virtual care where patients love the fact that there's more eye contact, even though it's in a box, imagine an in-person visit that is more like the old days, where the doctor actually looked in you in the eyes and actually did the examination. So I think healthcare is in a inflection point where we are going back to the future. Now, I told you I'm a family physician by training, and for me the romance of practice of medicine is actually taking the doctor's bag and going to a patient's home and actually taking care of the patient there. I think in the future, this is my black bag. And this is going to enable us to deliver care in ways which was not imaginable just 2 years ago. Well, it was imaginable, but I think we didn't have, the drivers were not in place. It's a lot of work to be done. I think we all have to come together and continue to work at it together. But I think the future is super exciting, and I know that my generation, but more importantly, your generation is going to come in and actually help us create healthcare that is really going to be unparalleled, historically speaking.
And guidance with the generation that's come before us, definitely. And thank you so much, Dr. Kohli, for that wonderful insight. It's been so telling with all these facts that were quite unknown.
Thank you.